A world without community health nurses is a dark world where health systems falter and communities are left vulnerable in the face of chaos. Good day, everyone. We are Group 3B of BSN 3F. I am MIZPAH YAEL Perez, and along with me are FRANZ DAVEN PELAYO, John Timothy RITO, and SHANNIE May Rodriguez. Our study is entitled Lived Experiences of Community Health Nurses in Enhancing Healthcare Access in Communities. With this, the purpose of the study is to explore the lived experiences of community health nurses or CHNs in enhancing healthcare access in communities, delving deeper into real-world insights about working at the grassroots level and health systems.
Research Instrument is a semi-structured guide that utilizes open-ended, unbiased questions to explore the lived experiences of community health nurses. It focuses on their professional journeys, the daily challenges of source-limited environments, and the strategies used to build community trust. The interview captures personal reflections on care delivery, success stories, and the systemic support needed to improve community health outcomes.
For this study, the researchers used a qualitative research design with a phenomenological approach. This approach focused on understanding the lived experiences of community health nurses and how they make sense of their daily realities in improving healthcare access. The study utilizes in-depth, semi-structured interviews, allowing participants to freely share their experiences while still aligning with the objectives of the study. 10 community health nurses from Negros Occidental were selected through all-purpose sampling based on specific inclusion criteria. The gathered data were analyzed using Brown and Clark's thematic analysis to identify common patterns, meanings, and themes from the participants' narratives.
Participants of this study were secured through the purposive sampling technique. 8 were females while the remaining 2 were males. The youngest participant was 34 years old while the oldest was 57, fitting the inclusion criteria of participants whose age has to be from 25 to 60 years old only. All 10 participants have at least 3 years of work experience of being a CHN, with 3 years being the shortest and 28 years being the longest, and all are graduates of a Bachelor of Science in Nursing. Although there are no limitations when it comes to their socioeconomic status, employment status, and marital status, we have found out that significantly all participants belong to the middle class. Only 2 out of 10 of our participants are on contractual employment, while the rest are working full-time. And 7 out of 10 are married, while the remaining 3 are single. These demographics play significant roles in understanding the variation of responses and experiences reflected in our results and discussion.
Now, moving on to our results and discussion, we have 6 major themes. And for the first theme, Theme 1 highlights how community health nurses perform multiple responsibilities beyond bedside care. Participants shared that they not only provide direct healthcare services, but also act as educators, counselors, coordinators, and community advocates. They often balance clinical duties with administrative work, health promotion, and community outreach. Despite these demanding responsibilities, the nurses demonstrated adaptability, dedication, and commitment to serving their communities. Now, for our Team 2 focuses on the different barriers that limit healthcare access in communities. Participants identified challenges such as geographical isolation, transportation difficulties, financial limitations, lack of resources, and low health awareness among residents. These barriers make it difficult for patients to access proper healthcare services consistently. Despite this obstacle, community health nurses continuously strive to bridge healthcare gaps and ensure that essential services reach underserved populations.
Theme 3 enhance improve community reach by moving beyond clinical walls. Through health education and proactive outreach, they equip residents with knowledge, while community empowerment and continuity of care ensure long-term, sustainable health improvements for underserved population. Theme 4, collaborating with professionals and support system. Effective service delivery relies on a robust professional network. Strong leadership, peer encouragement, and seamless interprofessional teamwork provides the necessary emotional and operational backing for nurses to navigate complex community health challenges successfully.
Theme 5 is entitled Challenging Work Conditions. This theme highlights the difficult realities faced by community health nurses in their daily work. Two sub-themes emerged, balancing heavy workload and high nurse-to-population ratios, navigating occupation and security risks. Participants shared that they often handle multiple barangays with limited manpower and resources, causing physical exhaustion and emotional stress. They also encounter risks during community visits, especially in remote and disaster-prone areas. Despite these challenges, the nurses continued delivering healthcare services, showing resilience and commitment to serving their communities. Theme 6 is entitled Incorporating Personal Values and Professional Commitment. This theme reflects how community health nurses remain dedicated to their work despite the hardships they experience. Three sub-themes emerge, evaluating impact and continuity of care, anchoring integrity and clinical practice, and evaluating impact on community health outcomes. Participants emphasized the importance of compassion, integrity, and respect for their patient autonomy in their practice. They also expressed the fulfillment in seeing patients recover and communities improve over time. This experience shows that personal values and professional commitment serve as a strong motivation for community health nurses to continue promoting healthcare access in their communities.
In conclusion, the lived experiences of community health nurses reflect resilience, dedication, and commitment to bridging healthcare gaps and enhancing healthcare access in the communities they serve. Their experiences demonstrate that community health nursing extends far beyond clinical care, requiring leadership, adaptability, and strong interpersonal relationships with diverse communities. Despite facing challenges such as understaffing, heavy workloads, inadequate resources, sociocultural resistance, and occupational risks, CHNs continue to uphold their responsibilities with compassion and professionalism. The study further revealed that proactive health education, collaboration with barangay health workers, and consistent community engagement are essential strategies in overcoming barriers to healthcare access. Moreover, the personal values of integrity, empathy, and service greatly influence their commitment to remain in the profession despite limited compensation and difficult working conditions. These findings emphasize the vital role of CHNs as the primary bridge between public health programs and the communities they serve, highlighting the need for stronger institutional support and improved workforce sustainability. In conclusion, strengthening community health nursing through enhanced education, policy support, and resource allocation can contribute to more accessible, equitable, and sustainable healthcare delivery in underserved communities.
For the recommendations, the researchers suggest improving support systems and resources for community health nurses to strengthen healthcare delivery in communities. Continuous training and stronger collaboration between healthcare institutions and local communities are also encouraged. These efforts may be improved through healthcare access and the quality of community-based services.
And that is all for our presentation. We hope that this has shed light on the lived experiences of our CHNs who serve selflessly and work tirelessly to ensure that no one in the community is left behind. Thank you and God bless.